Great. Thanks very much, Rick. So just reflecting on the day, it's been truly a whirlwind of outstanding talks. We've gone from fundamental immunobiology, as we promised, to epidemiology and clinical disease, to emerging treatment strategies in a way that I think, as one person privately messaged me, this has been breathtaking. So my sincere thanks to all of the speakers for your wonderful, wonderful presentations. And so now we're going to close the symposium with what I'm sure will be a thought-provoking presentation by Dr. Emanuel about societal and economic impact of SARS-CoV-2 and the COVID-19 pandemic. By way of just very brief introduction, which I'm not sure that Dr. Emanuel really needs, but nonetheless, it's my honor, so I'm going to go ahead and do it. Dr. Emanuel is the Vice Provost for Global Initiatives and the Diane and Robert Levy University Professor, as well as the Co-Director for Health Transformation Institute at the University of Pennsylvania. He has, until recently, served there as the Chair of the Department of Medical Ethics and Health Policy. From January 2009 to January 2011, he served as a Special Advisor for Health Policy to the Director of the Office of Management and Budget in the White House. From 1997 to 2011, he was Chair of the Department of Bioethics at the Clinical Center at the NIH. Dr. Emanuel is trained as a breast oncologist. He has written and edited 15 books and over 300 scientific articles. He's received dozens of honors and awards, notable among them the Dan David Prize for his contribution to the field of bioethics in 2018. Many of us enjoy watching him as a regular guest on CNN, MSNBC, and he often publishes pieces in the New York Times, The Atlantic, and the Washington Post. So without further ado, it's my pleasure to ask Zeke to give his presentation.
Great. So first of all, I want to thank Lisa for that lovely introduction. My mom would be proud. And it's always a great honor to both say yes to Cliff, which he doesn't ask often, but when he asks, I try to say yes every time, and then to follow him. We were colleagues for almost 15 years, and all I can say, he's just a tremendous colleague, brilliant, and the answer from him on every question you ask is yes. I try to emulate that. I'm not nearly as good as he is at being a nice guy. So I'm going to have a few slides looking at the future of COVID, and just to put it into context, I'm sure for many of you, it's, I don't know, you know it. So the first thing I think is we're going to see future waves of infection. And a lot of these are going to be followed after we loosen some of the more stringent public health measures. When we get the infection rate down and we go forward, inevitably you're going to, part of the point of loosening the public health restrictions is to create more social interaction, and inevitably social interaction is going to lead to a spike. One of the points I'm going to emphasize over and over again, we're especially at risk in geographies that open indoor spaces fast. Indoor dining, indoor bars, gyms, and other things. That is going to be a big problem. Hold on, why can't I? All right, this is just to show you the flu pandemic in 1918. I like to emphasize this graphic partially because you see multiple waves. The first wave was during a warm spell, not a cold spell. And then you see a second wave during the winter of 1919, going out into the spring. And then in 1920, another fourth peak. And you can see further down some echoes and mortality has happened. We are going to see the same thing, maybe not exactly like this. Maybe the second wave won't be as high as the first because we've gotten better. We'll have therapeutics. We're technologically much different than we were in 1918, 1919, but the idea of waves happening is definitely here. This is in my view, an important graph of new cases in France. And I think this shows you what happens, right? March, April, like the rest of Europe, they had a big burst of cases, but you can see they came down quite nicely. And we're able to keep it low until the August break in France, where everyone goes to the sea or the country, going up. and now it's beginning to come down. The second peak is higher than the first peak, basically double, not unlike New York in 1918, 1919. Having trouble with the slides. Let's talk about some of the economic and social impacts. You can see that estimates of this, actually a World Bank estimate of the coronavirus pandemic, has wiped out at least $3.5 trillion of earnings. This isn't total net worth or income. That's way more than that just in the United States. But in earnings for millions of people around the world, for those of you who don't keep track of it, that's at least 5% of world GDP. The World Bank actually calculates that up to 100 million people will fall into extreme poverty because of COVID-19. And again, this isn't extreme poverty happening over months and years. This is extreme poverty compressed into 6 or 9 months. This represents the first increase in global extreme poverty since 1998. So more than 20 years, we've had a steady decline, some blips up in the 2009-2010 recession, but this is a huge, substantial increase in global extreme poverty. The decline effectively wipes out all the progress made over the last 3 years since 2017, and that is, one of the tragedies of this pandemic. This is economic output in the United States, and you can see that in the second quarter we had this huge drop in GDP, and this is pretty unprecedented. You can look back at the 2010 recession, and we're 3 times as bad. Those of us who are in work that can be remote have weathered it pretty well. Those of us who work face-to-face hasn't been easy, and they have tend to be lower income individuals in the service sector of the economy who've really taken this and become unemployed. Unfortunately, that leads to a very big divide where a lot of the people who are making policy don't experience the worst of the pandemic. U.S. unemployment rate peaked in April at 14.7%. It's still incredibly high at 8.4%. As you know, between 800,000 and 1 million people per week filing for unemployment benefits. And it's a little hard to, many people don't think the 8.4% unemployment really reflects the experience of many people who are getting part-time work but not full-time work, and losing their benefits in the interim. And we still don't know anything about the long-term consequences of COVID-19, right? It's too new. We have no historical record. We don't know the mental health impacts of unemployment and poverty from this particular condition. We do know in general that unemployment is has a terrible mental health impact. It's kind of like divorce, and poverty even more extreme. We don't have a good sense for the lifelong health impact complications from the disease, how many people are going to have heart disease or lung disease, how that's going to affect the cost of healthcare, which is already extremely high, is going to be, I think, one of the key questions. And then we do know that people who become unemployed, poverty, or come out of school or come out of graduate school or professional schools at a moment like this where the economy is going down tend to have much lower lifetime incomes. And even if they get a job and the economy bounces back relatively quickly, their lifetime income is low because they start out at a lower income and the increases are lower. So we're looking at a whole cohort of people who are going to have a real hit in their lifetime income. Let me just say, I think Lisa mentioned that I'm a university administrator at Penn, the Vice Provost for Global Initiatives. And one of the things that's happening at our institution is we're not hiring faculty next year. Okay, there will be special faculty. It'll be on a selective case-by-case basis, but the hundreds of people we normally hire, probably close to 1,000 if you include the med school, they're not going to happen anywhere near that level. So that's a whole generation not going to happen. Secondly, on our graduate programs, most of the graduate programs, except for the few that are supported by grant funding from the NIH largely and maybe the NSF, they're not actually allowed to take any graduate students in. So there's going to be a whole gap of graduate training. How long that lasts and whether some of that becomes permanent, that'll affect a lot. I will say on the flip side, in terms of our admissions, we have seen continued applications. We have seen a slight drop in people actually matriculating. So for this first year, there was about a 7.5–8% drop in the number of people matriculating. Again, the long-term impact on a profession like higher education, a little unclear, but none of the parameters are going in the positive direction. What can open safely? What do we know about this? Regardless of vaccine timeline, it seems to me, assume we get a vaccine sometime at the end of the year or early next year. I think the next 15 to 18 months, we want to open up the economy, but we need to do so carefully. And let me just say, so far, we've done that badly, really badly in the United States. We have not opened up carefully. We have opened up in general, that's not to say every place, but we've opened up more haphazardly and more rapidly than we should. This seems to me the most recent case of Florida opening up everything it seems to me just a recipe for disaster. Some colleagues and I who were actually asked to make this graphic for Netflix to help educate the people working on their various productions. I think it emphasizes very much, we know the four main risk factors: enclosed spaces, duration of interaction, crowds, forceful exhalations. Places that have those, especially all four of them, are really, really high risk places. On the other hand, there are many lower risk places that I think, we know can occur. What we have not done, it seems to me, is open up progressing from, I think, your left to your right, from low risk to medium risk, and reserving the high risk only later in the course of events. Highest risk places, as I mentioned, enclosed spaces, crowds, prolonged period of time where coughing, yelling, shouting, a bar with a football on the screen or baseball on the screen, really bad place. And yet we have rushed to open those. I understand the pressure on local government officials. Bars are social gathering places. They employ a lot of people also at low incomes. They're, very, very, very key often to communities, but very bad idea from a risk standpoint. Now we have overwhelming evidence that that's the case. Given the risks, bars and indoor dining should be among the last to reopen, not the first. And unfortunately, as Florida has demonstrated, we keep falling into this trap. And I think it's going to make us keep recurring and not able to get our number of new cases down below 30 or certainly 25,000 per day, which seems like a terrible commentary on American fortitude. On the other hand, it does seem to me that we want to spend some time and really emphasize opening schools. There's huge benefits to children: socialization, education, reducing the stress on parents, getting them school lunches. You've heard all of this in the news. We have to consider the transportation, the time in the classroom, meal times, gym, extracurricular activities. But we could open them, obviously, only in areas with low transmission. That means that schools are only part of the larger socioeconomic situation. We can open schools when, in the larger socioeconomic situation, we have done our responsible activities of not opening up things too fast, keeping the transmission rate down. One of the places that could do that most effectively is New York, if it only had schools that could have more classrooms outside and had more space. They've done a great job about getting the transmission rate down, but the school situation, because of the architecture and the just the planning of them, is hard. Not far from my house, there's a school. I mean, not far, I mean a block away, and they have big tents outside where they're holding classrooms outside. It'll be a challenge when they go inside. So, I think we need to, when we think about the right kind of trade-offs, strictly imposing public health measures, enforcing small gatherings, no big weddings, no big funerals, no big groups, closing non-essential businesses, and all the other things that we have had to do, definitely infringe liberties and definitely impose costs. We should not, lie to ourselves. It's a problem if you can't go out to eat, if you have a small gathering and you can't get married with your 100 favorite people. But adhering to them strictly can actually generate more liberties and reduce costs. Because if we can get the very low transmission rates, it allows us to be more free and engage in more of the normal activities of life. And that is a trade-off I don't think we've communicated well. It is true, wearing a mask, staying 6 feet apart, not being able to go indoors to a bar, not being able to go indoors and eat at a restaurant, not being able to go to concerts or to sporting events. Those are infringements on liberty. Those do impose costs, but they lead to a situation that in actuality would allow us to be more free and engage in more of these natural activities. How do we know that? Italy, of all places. So this is the graph of Italy. And you can see they were hit about a week or two ahead of us, really quite severely. And in 8 weeks, they went from high peak, basically at the end of March, to low peak at the end of May. And they've kept low. They have gone up because of summer vacation, again, just like France, but nowhere near as bad. Was Italy locked down? Yes. March 11th, I believe, they locked down the north. March 12th, I believe, the next day, they locked down the whole country. The penalties were quite severe. You really couldn't go out. And they rigorously enforced that. And you can see what happens. You do it, you will bring the rate down. But then, when the rate was down, they were able to open restaurants, bars, shops, and hairdressers outdoors, gyms, museums, spas, and most gathering places, indoor cinema at 200 maximum with distancing inside. All had to observe social distancing rules, wearing face masks. You could not go into a museum. You could not go into a cinema without wearing a face mask. And you had to adhere to strict hygiene protocols. Masks are compulsory across the whole country in all public indoor spaces. So is that an imposition on your liberty? I don't know. It is a slight imposition, but if you can open up all these activities and still keep the rate low, that seems to me a trade-off we should be willing to make. Once you get that transmission rate down, the way the Italians did in May, you can begin to open up in a safe way. We have never gotten our transmission rate as low as Italy, except in certain geographies like New York, Connecticut, without rushing in and prematurely opening up the most dangerous spots, indoor dining and indoor bars. So my conclusion is we need to consider the trade-offs of short-term versus long-term freedoms and costs. We keep emphasizing the short-term in our country. I think we need to emphasize the long-term. Where long-term, I don't mean really long-term. I mean, what's the benefits after 8 to 12 weeks if you can get the rate of transmission down to 2 per 100,000 per day or something like that. So enduring 10 weeks of serious lockdown could have the advantage of giving people more freedom in the future. And as I mentioned, see New Zealand and Taiwan, both countries, roughly 500, 600 cases, deaths in the single digits. And if you talk to people in Taiwan, life is almost normal there. Where it's not normal is, guess what? people can't come and visit. Tourism is way down. And that is because the rest of the world's not as good. So we need to ask ourselves as a country, our short-term freedoms, such as choosing to not wear masks and insisting on indoor dining in bars, worth it? Or is it better to wear masks, forego indoor dining in bars for more freedom later, where later means 10 or 12 weeks down the line? Thank you very much, and I hope this gives you a perspective on how to think about the social and economic costs and how to make or think about trade-offs involved in the COVID pandemic.
Thanks very much, Zeke. That was, as expected, thought-provoking. I think, you know, it's been such a rich day, and I'm sure people are just trying to digest everything that they've heard. So let me ask you a higher order question. And you're a thought leader at the nexus of medicine, ethics, policy, and politics. How do we rally as a nation? How do we think about mitigating the impact of the long-term societal fracture that we have, the societal and economic impact? How do we think about getting ready for the next wave, which you assure us is coming? You know, I think it's not just difficult to deal with today, but for many of us, it's difficult to deal with the near and medium term.
Yes, I think that is going to be the issue that's going to confront the next administration if the administration turns over. If it doesn't turn over, I think President Trump's going to continue with what President Trump is doing, which is basically trying to put this pandemic behind him and put all the pressure on the vaccine. But if you think about, you know, we're not going to get a vaccine to the vast majority of Americans until the end of 2021 at the earliest. You have a year in which we have to live with this. And so you have to have a president and administration that walks the walk, does all the social distancing, wears the masks, continuously emphasizes to people, here's the cost in the short term, here's what we're going to gain in the long term, and puts an infrastructure in place and supports governors and makes it appropriate for governors and local officials to do the right thing. Right now, there's no incentive to do the right thing, and every incentive not to. I would also say that had we started out in a different place with a different level of income support for people, adopting closer what they've done in other countries like Germany, where everyone, you know, got a sort of basic income to tide them over, compliance might have been much, much better in this. You know, instead we allocated $2 trillion, but I don't think we allocated it in a wise way. The $600 extra per week for people, you know, you're in a pandemic that you know is going to last 18 months or at least, and you do this for only a few months. That's like, doesn't make any sense. Part of what people need, want, and seem to be asking for is security. And that kind of security, it really requires, this is going to last the time of the pandemic. We're going to support you so you can meet your rent requirements. You can get enough food on the table. And that will make people more willing to listen and to do the adherence and to come together.
Yeah. So I think that, you know, that's the hope, is that some of the fractures can be healed, that we can come together, that we can look beyond this, and that we can be smarter. We should never go through this again.
Well, I would say the other thing that's going to have to, part of that education process is educating people about when the vaccine is going to be available to them, so that we do not have this, oh, you got a vaccine, but I can't get it, and somehow, you know, make this a competition among people, rather than we've got an orderly process, we've thought it out, here's why we're doing it, to keep the number of deaths down. I think that's going to be really, really important to lay that groundwork before going out there.
So just to pick up on, in closing, one final theme that was scattered through several of the talks today. You know, the various news media present data that says 29 to 40% of the overall population is ready to consider a vaccine, receiving a vaccine. That leaves a large number of people who are not. So you have the competition issue on the one hand, and on the other hand, nah, I don't really need this. And so there's a duality that's going to need to be dealt with.
Yeah, I think in the abstract, that's where people are. I think if we have a vaccine, if we have people like Tony Fauci, if we have people like the president and the vice president, the cabinet officials taking the vaccine, if we begin and make transparent all the accumulating safety data, people begin to know other people who've gotten it or healthcare workers who've gotten it. I think that worry that it was rushed through, it really wasn't evaluated for safety, it will very much mitigate, and people will want to get a vaccine. I think that is again, this administration, I don't want to be political, but this administration has, I think, stoked rather than assuaged the worries about safety of vaccines by rushing in. Look, I think I'm a rational person. The data I've seen, and I don't know who lectured on this, but the data I've seen that says, well, if we have 35 or something events and a vaccine that's greater than 76% efficacious, that's enough for, to get statistical significance. I would say you're going to immunize 300 million people or even 30 million Americans on the basis of 32 events? That seems insane. That wouldn't convince me that it's a safe, effective vaccine. That would convince me you've terminated that trial too soon. So I think we need to understand not just the statistical significance, but the clinical and psychological significance of the studies we're doing, because that's going to be important to getting people vaccinated. As you point out, Lisa, or imply, a vaccine that's in a syringe and not in the shoulder does no good in terms of protecting the public. We need vaccines in shoulders, and vaccines get in shoulders only if people are willing, and people are willing when they believe it's safe and they believe it's effective. That requires thought leaders, influencers, and politicians and celebrities to get the vaccine. It also requires them to confirm, yes, the data are pretty robust. We're going to continue to monitor, but you can trust this. And that's not by, but by the president declaring it safe, or Steve Hahn even declaring it safe. You need something like the independent vaccine and, other biologically related items, advisory group at the FDA to say, yes, we've looked at the data, and you have to begin to establish this overlapping views that they're getting a lot of signals from different people that this is safe and working. And it seems to me we need to think about that, not just the statistical p-value, because the statistical p-value here may be totally worthless vis-a-vis the American public.
So, Zeke, I think that's an appropriate place to end, a clarion call for science and scientists and reason. It's been a terrific day. I want to thank all of the speakers for wonderful, wonderful presentations. I want to thank Shadon and Brandy for doing a great job with all of the audiovisual efforts. And most notably, I want to thank Stephanie Norman, who did an amazing job staffing this. So why don't we close this session? Thank you to everyone for participating, and good night. Thanks.